We like to see patients at the dental office for regular exams and cleanings as early as they have teeth, so we can find any problems early on and establish a good routine of dental care for regular checkups. One thing that I see a lot is people don't really realize how much their daily habits affect their oral health and how much oral health affects your overall health. Hydration is really important because dry mouth can put you at a higher risk for cavities. We want to avoid anything that has high sugar. I always tell patients the best thing that you can snack on is vegetables, fruits, or look for things like meat sticks or cheese. Smoking tobacco or any tobacco use can affect your gum tissue health. There's different stages of gum disease. So gingivitis is the first stage of gum disease. That's inflammation of the gum tissue. You might notice that your gums are bleeding when you're brushing. They're kind of red and they're puffy. Gingivitis is reversible, usually through having your teeth cleaned at the dentist and really working on your oral hygiene. But if it is allowed to progress and it isn't reversed at that stage, that's where it starts to affect the periodontal ligament and the bone that hold and support your teeth in your mouth. And once you lose that bone, you can't get it back. And somebody that has periodontal disease might notice that their teeth look longer, they may become loose, they may have bad breath. There's lots of factors that can contribute to periodontal disease and predispose somebody to periodontal disease. It can be genetics, tobacco use, alcohol use, your oral hygiene, your dental history, how often you go to the dentist. A lot of times people may see blood when they're brushing or flossing and they think it's because they did something wrong. More often than not, it's just kind of a sign that your gums are not healthy from lack of brushing or flossing, or maybe you need a dental cleaning. So if you're noticing blood when you're brushing or flossing, ask your provider when you go in. They can maybe take a look at the technique that you're using or be able to tell by looking at your teeth. I would recommend a fluoride toothpaste for everyone. If you have a child who is still swallowing the toothpaste, then look for a fluoride-free toothpaste until they are able to spit. I would recommend an electric toothbrush, but a regular traditional toothbrush does a good job too. You should only brush your teeth with a soft or an extra soft bristled toothbrush. Aggressive brushing or using too hard of bristles can cause gum recession. That is irreversible. Everyone should be brushing their teeth at least twice a day and flossing once a day. Flossing doesn't have to be perfect, but as long as you're consistent with that, that's what matters. As far as mouth rinse goes, I would recommend a fluoride mouth rinse for anybody who is at higher risk for cavities. Some things that you do want to be careful of are the alcohol-based mouth rinses because they can actually dry out your gum tissues. It's really important for routine dental care so we can diagnose and catch problems early on when they are more treatable. The longer that people go or wait to come into the dentist, the chances increase that tooth decay has gotten so severe that it's not treatable or restorable. For your routine visits, we normally see people and we'll take some x-rays. The dentist will come in and do an exam and the dental hygienist will do a cleaning. So after your dental visit, we usually give everybody a free toothbrush, a packet of floss, and some fluoride toothpaste to help you care for your teeth at home. Many people face financial barriers to dental care. A lot of times if they have a dental insurance, they try to find a dentist that is accepting their insurance plan. At Northern Dental Access Center, we provide access to patients who may be struggling to find a dentist because of their insurance or lack of dental insurance. One thing that we tell a lot of our patients is to contact the number on the back of their insurance card if they have one of the state plans, Prime West or Blue Plus. A lot of times they have care coordinators that can help them, whether they need help with transportation to their appointment or finding somebody who takes their insurance. Here at Northern Dental Access Center do have different programs too for patients that have barriers to care, whether it's offering a gas card if they need some help paying for gas to get to their appointment, or if they can't find childcare for the day when they're coming for their appointment. There's usually somebody here that can watch the kids for them while they're getting their dental care done. So if people have barriers to care, it's just really important that they let us know what's in the way and we can try to help them address that. If you have a fear of the dentist or you are afraid of going to the dentist, it's really important when you do go in to let that provider know that you have a fear or you're anxious about your appointment so that they can make sure that they're explaining everything to you, that you get your questions answered, or just to help put you at ease during your appointment. I see a lot of people who come in and it's maybe been 10 years or longer since they've seen the dentist, and one of the main things is they're embarrassed. They're embarrassed that it's been so long since they've been seen, so they kind of put it off and they don't want to come in. And And I just want people to know that they don't need to be embarrassed about that. The most important thing is just coming in and getting in the office to get your dental work.